Welcome to another episode of Easy Access to Healthcare for All, a program which brings you news and issues around the National Health Insurance Scheme as it drives Nigeria towards universal health coverage. My name is Aisha Muhammad Ahmed, your regular anchor. One major factor towards determining how quickly Nigeria attains universal health coverage is how well the objectives of the scheme are received by the public. That reception, to a large extent, depends on how much enrollees sees that the NHIS is providing towards meeting their health needs. In continuation of our enlightenment on what the NHIS offers as its benefit package, we bring you details of other services that the scheme offers to make life easy for enrollees when the need arises for them to get healthcare services. Those details are what we shall be focusing on in this episode of the program. Please stay tuned for the full program after the break. I will be back shortly.
Easy access to quality healthcare for all. NHIS.
The program kicks off with a highlight of events around the NHIS. Stay tuned.
The Executive Secretary of the National Health Insurance Scheme, Professor N.M. Sambo, on Tuesday the 12th of April 2022, played host to a team from the Bill and Melinda Gates Foundation. The visit was to get an understanding on the Basic Healthcare Provision Fund, its progress, its challenges, and areas it needs support, as the team reported that they had earlier met with several stakeholders in the health sector. While welcoming the team to the NHIS headquarters in Abuja, the NHIS boss described the Basic Healthcare Provision Fund as a subsidy arrangement from the federal government backed by the National Health Act to provide complementary funding through the NHIS system for states towards catering for the health of the vulnerable in the society. Professor Sambo further said the program is designed in that way since the states are closer to the communities and can identify them and to push the mandate of attaining universal health coverage. Responding to the presentation, Dr. Tracy McNeil said the team is impressed with what the scheme is doing and promised to reconvene again with strategies to impact the healthcare provision. The Bill and Melinda Gates Foundation is a non-profit organization fighting poverty, disease, and inequity around the world. As part of efforts to deepen awareness of the Group Individual Family Social Health Insurance Program GiveShip, the National Health Insurance Scheme NHIS has conducted sensitization exercises in Ogun State for healthcare providers. Speaking at the event, Mr. Omo Akande, Ogun State Coordinator, told the hospitals that GiveShip was designed to operate as perfectly as the formal sector program, stressing that the GiveShip benefit package was not different from what is obtained in the formal sector program. In another development, the National Health Insurance Scheme NHIS has conducted accreditation exercises in some facilities. The Osun State Coordinator, Mrs. Adekunle, led the Standards and Quality Assurance Department of the state's office to carry out the exercise. Adekunle stated that a total of 10 facilities and 16 services were accredited to offer services under the auspices of the scheme.
The program is Easy Access to Healthcare for All. Since inception, the NHIS has been saddled with the responsibility of giving Nigerians access to quality as well as affordable health care. In our next segment, Issues around the NHIS, we shall see other efforts by the scheme to make sure enrollees access healthcare at an affordable rate whenever the need arises. These efforts include measures to put an end to discrimination of NHIS enrollees, cancer treatment initiative, cost sharing on expensive drugs, and many more. Let's find out what the NHIS has done along these lines.
Easy access to quality healthcare for all. NHIS.
The NHIS benefit package is robust and meets the daily needs of enrollees. As they testify, the scheme has helped them to meet their health needs.
I've really enjoyed the services. You know, there are times you may not have immediate cash with you, an emergency will just come up. Just like this very last night now, my baby started running temperature and difficulty in breathing, and I was not buoyant enough. So that is when you really know the impact of NHIS.
It's very good, to be honest. I'm enjoying it. And the 10%, people, so many people joining the NHS because of that 10%. You don't have to pay your medicine bills, all of it. You just pay 10% and that's it.
For ease of making healthcare accessible, the scheme has given enrollees the leverage to choose their preferred facilities for accessibility in time of need. However, this choice seems to be part of the delays encountered at the healthcare facilities. Dr. Agada explains further.
Because NHIS made it giving the enrollees the choice, the freedom to choose whichever healthcare facility they want. The only thing we can do at this point is to continue to provide information to sensitize people, because people are at liberty to choose any of the facility that we have registered as a primary healthcare facility. Maybe with time people can start talking of capping. Maybe people will need to also know that the primary health centers, the primary health care has to develop properly for us to get to where we want to go to. So people need to choose the proper primary health centers for those ones to also have enough resources to develop and be able to provide the services. But like I said, NHIS has given that freedom, has waived the freedom of choice of facilities.
To fulfill this mandate, NHIS has continued to make sure enrollees are treated fairly without discrimination when they visit the facilities.
What we have done, I've mentioned the recruitment of medical professionals at the state, and we are developing programs where there's the recent one that we're looking at, what we call the NHIS strategy to improve the responsiveness of healthcare facilities. So we are working on several ideas that we feel. We have also developed the healthcare facility accountability framework that we will be deploying very soon. So we are hoping that with that and with the presence of the call center, one of the strategies we're thinking of is to have the phone numbers of the doctors at the state offices in every healthcare facility that is accredited by NHI. So for example, if you are in FCT, the phone number of the doctors and the professionals who are in the FCT state office will be available in every of our accredited facilities.
Like most healthcare insurance packages, there are certain exclusions in drugs administration.
We tell people that what we have as the NHIS drug price list is actually cannot be so comprehensive that it can contain all the drugs. So what we have done there is just a guide. It's a guide that these are the drugs that we have. Look at. There are so many things in listing drugs, loading your benefit package. There are issues of health technology assessment. You need to be well informed. What are the advantages of new drugs you're bringing on board? But by all means, we are not telling any hospital not to give drugs. What we're saying is that based on the resources we're providing, we think that if you go with these drugs, our enrollees should be okay.
Still on drugs, he explains further.
Out of stock is not a part of NHI, so it should not even arise anywhere. All right? As long as the NHI has a drug list, which every facility that is under NHI should have. Nobody should tell anybody that a drug is out of stock. It's not part of NHIs. And it's not good. Because what we are seeing now is that the healthcare providers are trying to make Nigerians begin to suspect that NHI is not really, and we are hearing it everywhere. Yet, one thing is that these guys are paid upfront. So, and when you come into NHIS and sign a contract, an agreement to abide by the guidelines of NHIS, there's no need to tell anybody that is out of stock.
So, what then is NHIS doing about the out-of-stock syndrome that bedevils enrollees when they visit the healthcare facilities? And how should enrollees react when faced with the challenge?
We are very mindful of the fact that a lot of our patients are going to hospitals and they are not getting their drugs. There are many stories about this. I have also spoken recently with a lot of our private providers, and they have told me that they are giving drugs in their hospitals. But we are also mindful, because there was a study we did around 2015, 2016 that shows clearly that a lot of our patients, especially hypertensive patients, diabetic, the non-communicable disease patients, chronic diseases that goes to hospital frequently, a lot of them have complained to us that they are not receiving their drugs are not being dispensed to them.
The NHIS on its part has taken steps to address the situation with drugs or medicine administration through the Medicine Supply Initiative.
So we came up with this concept of NHIS Drug Medicine Supply Initiative, which were at the advanced stage of rolling out. Maybe by the turn of the year, by the middle of the year or so, we should begin to see real progress. The Minister of Health has already approved that initiative. Initiative speaks to the availability, accessibility, affordability of drugs, and the quality. In the committee that is overseeing that policy, we have the NAFDAC, we have the Federal Ministry of Health, we have NIPRID, we have Nigerian Customs Service, we have Ministry of Finance, Ministry of Trade, Investment, we have the PMG-MAN. PMG-MAN is the Pharmaceutical Manufacturers Group of Manufacturers Association of Nigeria. They are representative of pharmacists, pharmaceutical companies in Nigeria, and we are working with them to brand drugs for NHIS. So once you have those branded drugs with NHIS logo on it, just like we had PTF drugs those days, you can 100% be assured of the quality of those drugs.
The scheme is also working tirelessly to ensure that it gives succor to more Nigerians even when their health conditions is not included in the healthcare benefit packages.
We've had issues with this, and we are mindful of the narrative in the out there that once a diagnosis of cancer is made, you are a dead man. We want to change that narrative. We want to give the Nigerians hope that diagnosis of cancer doesn't mean death. For us at NHIS, we are already doing the surgeries for cancer. We have mastectomy for the breast. We have prostatectomy for the prostate. We have hysterectomy. We have the different surgeries that are done, removal of lumps and all that, already covered on our benefit package, which is part of surgery and all that.
The scheme recently signed Memorandum of Understanding with companies that will bring in high-tech medication for cancer. This will ease the financial burden on the patient, as both NHIS and the company bears part of the burden when a patient accesses the medication. The NHIS, however, accommodates organizations who demand for a different or an upgraded health plan that will give them a more comprehensive benefit package.
The benefit package is very comprehensive. Now there are certain things that are, like I said again, this is a social health insurance program. So we are not against organizations who want more to come on board and say, okay, we have seen your benefit package. You don't have admission in private wards, for example, in amenity wards. Okay, you don't have provision for ambulance to quickly move our people to hospital. I'm aware that the Ministry of Health, working with NHS and other agencies, are also trying to develop ambulance services. All this, we are saying that you can have and like something like NHIS Plus. So for such organizations, if they approach us, we're able to work with the HMO to provide enhanced benefit package for them.
But at what point in accessing healthcare is an enrollee expected to make payment for services received?
For the covered services, the co-payment that we require from the enrollee is 10% for drugs alone, not for lab, not for treatment, but just for drugs. Now, what has happened? Just for drugs, 10%. So, for example, you go to a hospital, the doctor sees you, you go to lab, and you are seen, and all the other services that you need, physiotherapy, everything. The only thing we expect you to pay is when you collect your drugs, and the total is 500 naira. The total amount is 500 naira, computed based on NHIS tariff. You are going to pay 10%, which is 15 naira, to the hospital.
Enrollees are expected to also make co-payment of 50% on oncology drugs and some very expensive drugs, and there are also partial exclusions where an enrollee pays certain percentage on MRIs and radiotherapy. Aside that, NHIS covers every surgical procedures and consultancy with doctors. The NHIS is not arbitrary in its decisions. The benefit package was drawn up with welfare and health of Nigerians being the topmost consideration. There are logical reasons for exclusions and cost sharing for enrollees when they visit the facilities.
So exclusions are those procedures that we do not cover, that is not covered under the benefit package. And I've already given an example and the reason for why they are excluded. Example is artificial insemination. Another one is organ transplant, cosmetic treatment. We feel that people who do cosmetics treatment should be able to, like liposuction and all that, should be able to go and pay for it. And then there are the organ transplant, which I've mentioned because they are expensive. We are also, like I said, we assure our enrollees that we are trying to do some innovative financing to see how we can help in those areas. The Workman's Compensation Act, those things that are covered under it, injuries in workplaces, I've mentioned natural disasters, epidemics and all that. So those they are the few ones that we have as exclusion.
Welcome back. Today on our Stakeholders segment, we'll bring you an exclusive interview with Professor Hadiza Galadenti, a renowned gynecologist who is passionate about maternal care. She is the proprietress of Standard Hospital Limited, Kano. She gives a brief on how and why she ventured into the private care.
When I came back to Kano as a gynecologist and obstetrician and working in the teaching hospital, I realized the need for private health care. I had quite a number of patients that will come to the teaching hospital, but would tell me, please, doctor, can I see you somewhere else? I wasn't really ready to go into private practice, but the gap was quite obvious. And I realized that the only way I can function well as an obstetrician and gynecologist was also to give people an opportunity that they can see me privately.
Professor Galadenti is also an advocate of health insurance, and she expresses her views on the National Health Insurance Scheme.
NHIS scheme is an excellent scheme to support Nigerians to be able to get quality care. And I think, when Nigeria decided to have NHIS, I think it was a great, decision. And I know we had a lot of teething problems. As usual, you have a lot of teething problems before you can actually get it right. But we are on the way of getting it right.
She speaks further on the scheme's coverage.
NHIS does not cover the whole of Nigeria. The percentage is still minimum. I probably don't want to say a percentage because I'm not really sure of the percentage, but I know it's minimal. Now, what we need is that the states, as I can see, some states are also providing health insurance scheme. So the states should also get into the they should provide insurance for their population. Then community insurance. Because right now, I think NHIS is just taking the tip of the iceberg. You have the state and then you have the community. The community is the largest as far as I'm concerned. That is where, for example, all the complications we have in obstetrics and gynecology is in the rural areas. And the rural areas cannot access NHIS. So we've got to ensure that there is community insurance, which I think NHIS is it's on the way of getting that. Yes, through the basic healthcare scheme, we should have insurance for everybody.
She also applauded NHIS for its no indebtedness policy, as it has helped in reducing late or no payment by health maintenance organizations.
I think NHIS has done us good by introducing that indebtedness is a letter of non-indebtedness, because that's the only way NHIS will give them their money. So you have to sign that they are not owing you, all right, before NHIS pays their fees, and that has made HMOs to be paying back the facilities. But I think we still have some HMOs that are still giving us problems. At times you go to hospitals and you see that we're not taking any more patients from this particular, HMO, because you have almost 6 months, almost a year at times. Your fees are with them and they have not verified, neither have they paid you. Even as I said, I think it's getting better, much, much better.
She speaks further on some challenges bedeviling health insurance and the health sector at large.
I feel that we need to improve the capitation. We need to review even though we have reviewed some of our services, I think there's still some that need to be reviewed. Then there are certain services that are not covered by NHIS. For example, I'll give you an example. I'll also go back to gynecology, infertility. Infertility, the investigations in infertility are covered, but I think the treatment is not covered. Such an amazing thing. How can you cover an investigation and don't cover management? Investigation is part of management. So I think the drugs are not covered. Fertility drugs are not covered. So I think that needs to be looked into. There's certain services that I feel NHIS should review and probably include.
That was Professor Hadiza Galadenti, a passionate obstetrician and gynecologist and an ardent advocate of health insurance in Nigeria, sharing her thoughts. We will now take your questions in this last segment of the program.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled?
How can I get enrolled?
Question: if I am single, can my children benefit from my contributions?
Definitely. Your children, once they are biological, it doesn't matter. I mean, we don't decide whether you are married or single. The basis is that you are actually a contributor under the health insurance system, and we can verify that the children that you are registering are your biological children, or whether biological or adopted, as long as we have proof that they are your children.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
I think I paid almost nothing.
It went easy. We only paid 10%.
We all work towards accelerating universal health coverage.
Everybody, irrespective of his gender, has access to basic healthcare services.
And so, we draw the curtains on this episode of the program. We all have a responsibility in helping Nigeria attain universal health coverage by keying into the NHIS and letting more Nigerians know that they can enjoy social health insurance even if they are in the formal sector. Remember, it is health that is real wealth and not pieces of gold and silver. See you next week.